President Biden says we could see a return to some normalcy by the 4th of July. In his first primetime address since taking office, the president announced he's directing all states to make COVID-19 vaccines available to everyone 18 and over by May 1st. But the president also warned that now is not the time to let your guard down. For more on this, I want to bring in Dr. Bob Lahita. He's the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health and a professor of medicine at Rutgers and New York Medical College. Dr. Bob, thanks so much for being with us. So the president touted that vaccines are becoming available earlier than expected. I want to play a clip from his announcement last night.
All adult Americans will be eligible to get a vaccine no later than May 1. That's much earlier than expected. Let me be clear. That doesn't mean everyone's going to have that shot immediately, but it means you'll be able to get in line beginning May 1. Every adult will be eligible to get their shot.
So what do you make of this, Dr. Bob? The idea that we could all have accessibility to vaccines by May 1st, that would be welcome news. That would mean that by July 4th, by the holiday, that most of us could start planning vacations.
Yeah, that's incredible, Vlad. I think it's a wonderful goal that May 1st for all those who are years 18 of age and over. And so he's saying that on July 4th, Independence Day, we will be independent, in a way of speaking, from this virus and be allowed to have small barbecues and gatherings. That's a big deal because we're looking really at the end of this pandemic. The only glitch here, Vlad, is the fact that about 30 to 40% of Americans are still fearful of this vaccine, which I find to be incredible. And they will not line up to get the shots. Those people who are anxious to get the shots, who have no comorbidities, for example, have been looking on their computers and calling and doing all sorts of things to try to find a place to get this vaccine. So it is a real challenge in a way, but it's really, really wonderful to hear that we'll have 100 million shots by his 60th day in office.
You mentioned what the president said about being able to gather in small groups and barbecue for Independence Day. I want to play some of that sound.
July 4th with your loved ones is the goal. But a lot can happen. Conditions can change. The scientists have made clear that things may get worse again as new variants of the virus spread.
Okay, so, with all of his promises, there were some qualifying words and phrases. Some of those had to do with us and our behavior. And, he brings up these variants. How could the emergence of these variants alter that timeline?
Well, these variants may have some issue here. We have a variant now in the New York area. We have a variant in California, which has basically taken over about 51% of the country. And these variants are pretty aggressive in that they're more infective and they tend to spread much more easily, I guess is the term. And we are seeing blips where all of a sudden you'll see a surge of some patients for 2 days. And the genomic analysis of these variants indicate that, yes, they are mutating. Viruses, as I have said many times, Anne-Marie, do that. They like to mutate. The vaccines that we have currently, the 3 of them, in the United States should be okay to control these variants, and they're popping up periodically. But again, I go back to those people who don't want to be vaccinated, and they are a reservoir, a potential reservoir for all of these variants. And if people don't get vaccinated, we're going to have this virus hanging around for many, many years, not months, but years. And the variants are going to be the predominant types of virus we're going to see.
So, Dr. Bob, Thailand is joining the growing list of countries that have temporarily stopped using the AstraZeneca vaccine over blood clot concerns. AstraZeneca released a statement saying there's no evidence that their vaccine comes with an increased risk of issues stemming from blood clots. Is it at all possible that it just didn't happen during the clinical trials, or is it a coincidence that some people had an underlying condition?
Well, I think the latter is the case, Vlad. I think some people have an underlying, what we call in medicine, a procoagulant state. That means that their blood is likely to clot much easier than others. It's a rare situation, but after looking at 10 million cases, and that's a lot of people, AstraZeneca is saying that there is no evidence that clotting is a result of the injection. Nevertheless, Thailand, Denmark, Norway, Iceland have all put a stop and a hold on the AstraZeneca vaccine. I think the 2 cases that have been reported are probably just the normal occurrence of people having pulmonary emboli. Embolus is a clot, pulmonary emboli, or clots in other parts of their body. We see patients like that all of the time. Every week we see a number of people who come into the emergency room and are admitted because of blood clots. So blood clots themselves are not rare, but to have it as a result of a vaccine is unusual and would be rare. And AstraZeneca says that's not the case. Let's back up here and look at the data. 10 million people got the shots in their clinical trials, and nobody, but nobody had a blood clot.
So there's been a lot of speculation about the vaccine and pregnant women, because typically pregnant women are not deliberately included in, the trials. Sometimes people get pregnant along the way, but that's not the plan. So now we're hearing this, that pregnant and lactating women who got the Pfizer and Moderna vaccines had similar immune responses to women who were not pregnant. So we have to note that these findings have not been peer reviewed. But what does that tell us about how safe the vaccine might be for people who are pregnant?
I think the vaccine is perfectly safe for women who are breastfeeding and women who are pregnant. Apparently, the study in the original clinical trials, pregnancy and breastfeeding was not included purposefully. But now that we have seen quite a number of women who are pregnant and or breastfeeding, it seems that they have just as good an immune response as a woman who is not pregnant. So that's good. That's actually great news. So women who are pregnant don't have to worry that the vaccine is going to cause some kind of untoward effect towards their carrying the fetus, or that it's going to affect their ability to breastfeed their babies. And I think that's good news, Anne-Marie.
Yeah, that's going to be a relief for a lot of people. Dr. Bob Lahita, thank you very much.
Thanks, Anne-Marie. Thanks, Vlad.